I'm Dr. Joe Mills, Professor of Surgery and Chief of the Division of Vascular Surgery and Endovascular Therapy at Baylor College of Medicine. Vascular surgery treats lots of different problems with your blood vessels in your body. So the most common things that we treat are blockages in the arteries to the leg, which may limit your blood flow so that it's difficult for you to walk. You may be a patient with diabetes who has developed an ulcer or a wound on your foot that won't heal. You may have sought out multiple opinions on what to do for this. You may have a blockage in your neck artery and be concerned that it may cause a stroke. Or your doctor may have found by an ultrasound or some other test that you had a weakening in one of the major arteries in your body, in your abdomen, and you want to know what to do about it. You're worried about it. So we want you to contact us at the Vascular Surgery Division at Baylor College of Medicine. And the first thing we do is get a complete history. We get your records, we find out what your family history is, we find out what your other medical problems are, and then we try to put whatever your problem is in perspective. So what is the risk to you if we treat this problem medically? Can it be treated medically and be safe? And most of us would rather have the least invasive therapy possible if it's going to be safe. So if a pill that has few side effects will get you the same result as a more invasive procedure that has more side effects, most people would actually choose the less invasive approach. Then let's say you need therapy for this that's beyond medical care alone and reducing your risk factors. We have 4 specialists now that work with blood vessels and 2 that work on the foot, and there are multiple different options. So what we offer you is a complete evaluation, and we try to pick what's the best option for you. So what's the safest? What's likely to give you the longest period of relief? What's the lowest risk to you for the procedure that's offered? So we don't try to do the current hottest procedure on everybody. We try to do what we think is going to give you the best outcome. And different patients feel different about risk taking. So I won't take an unnecessary risk that I think is wrong for the patient, but some patients have a different understanding of, they would prefer a procedure that may not last as long, but their hospital stay is much shorter than get right back to work. So you really want someone that can advise you on, should I have this procedure now? Would it be safe to wait? If I change my lifestyle and work on my blood sugars and lose some weight, will this problem get better? Do I really need to have that procedure at all? So I actually spend a lot more time with some of the patients that may have milder disease, maybe trying to convince them to try some simpler things first.